The latest surge in COVID-19 cases is driving healthcare workers at Edward Hospital in Naperville to experience a bit of déjà vu with where the community stands in navigating the pandemic. Edward Hospital President and CEO Joe Dant says people who are unvaccinated are taking the bulk of the blow dealt by the virus.
Their level of acuity and their level of illness is also similar to what we've seen, in some of the past surges. So again, those patients are, pretty acutely ill. Their oxygen requirements are higher. Typically those are the patients that if we have patients in the ICU, it's typically going to be, that set of patients that are completely unvaccinated.
As of this recording, the number of patients with COVID-19 has fluctuated daily between a low of 113 and a high of 123 over the past 11 days. That figure includes anyone, including pediatric patients, who happen to test positive while visiting the hospital for an unrelated service, and whether or not they are asymptomatic. A majority of the inpatients with confirmed cases of COVID-19 are in the hospital due to COVID-19, according to a hospital spokesperson. Dant says something has to give.
It's taken a toll from two accounts. One, it's just discouraging and disheartening that when we think we're clear of this and numbers go lower, we have other surges that bring us back up again. And certainly, Omicron this time around is part and parcel to that. But we also think people are just maybe tired and generally all of us are maybe more tired of some of the restrictions. So our staff feels that.
Healthcare workers are not immune to the Omicron variants of COVID-19 either.
One of the things that's just harder is that we have more staff out sick, either with something seasonal or with COVID or exposure to COVID. And so then that's just made then the stress on staffing that much harder.
At the same time, staffing has been at issue due to early retirements, turnover, and burnout. With the latest surge, the leadership at Edward Hospital has paused certain services, such as elective inpatient surgeries, to free up staff to take care of COVID-19 patients. Dant hopes the work of healthcare workers will not be for naught as the pandemic moves forward.
Same people who were acclaimed as heroes at the beginning of this pandemic are the same people still here fighting it, every day, and we need the support from our communities, our patients, our families.
For Naperville News 17, I'm Megan Horsted.